Hi, this is Chris Wall again, Chief Executive Bevris Support, with our Covid-19 Bulletin number 6, 31st of March today. And we've not got quite so much to say, but I really want to make sure that we keep up the kind of communications that we have been. The first thing that some of you may notice is the ever increasing length of my hair. I'm going to ask Bev to sort it out at some point, but I've really got to pluck my courage up for that one. Okay. Following a management team, again, I'm going to read from my paper. Following a management team meeting online again, using Zoom today, I'm writing or speaking on behalf of all of the directors. This vlog is also in written format and emailed to everybody we know. What we're finding now, after around 4 weeks of planning, getting ready, and then moving into the what people call lockdown situation, is actually we're starting to work in a new normal fashion. That's what we're calling it anyway, the new normal. Many issues we discussed on our agenda, though, were run of the mill. And that's brilliant, because that's the first time for quite a few weeks now that we've just had some of the ordinary run-of-the-mill issues. Those are things like who's done which training, how many supervisions have we done, how many appraisals are due. Those kind of basic norms are things that we actually talked about today, and I think that really says a lot about where we are with our planning. So, we did, of course, discuss Covid-19. The current situation is very, very difficult, but there are signs. I think people have noticed that the infection rate, I believe, is being held. The high curve that the government wanted to avoid is starting to be flattened a little after this first week of lockdown. So, we've had quite a few members of staff who self-isolated. They're back at work this week and they're doing really well. I don't think we feel that anybody who's actually self-isolated, either because they were symptomatic or because somebody in their household was, has actually come back with any sort of difficulty in terms of their health. They've all come back healthy and well, which is really good. Difficulty being, of course, that we understand people have some mild symptoms. In fact, some people don't have symptoms at all. This makes it very, very difficult to get this self-isolation right and to understand who has and who has not had the virus. Okay, our management team, they've been really, really busy. We're trying to ensure that at least once per week each staff member is contacted. We're calling these welfare stroke supervision calls. Rotas are constantly being changed at the moment due to the self-isolation of people. This does continue, of course, even though we have people back, we now have some other people off. So this does mean that there are difficulties with rotas. We're trying at the same time to reduce the amount of staff we have working with any given service user in any given location. That is also impacting on the rosters as we try to change things around. Of course, as much as we want to try and do this, due to the fact that people will have to self-isolate, we can't reduce the team down to, say, 1 or just 2 people, because when self-isolation occurs, we haven't got anybody who might know that person well enough to work with them. So it does present us with quite a puzzle. We can only do our best. Be interested to know if anybody wants to tell us how staff are feeling about having their supervisions, welfare calls, and their main contact with our management team being either FaceTime, Skype, online, telephone, etc. It'd be good to know. We're making welfare checks to all our clients and families by phone. The management team are maintaining contact as appropriate and will continue to support families as much as possible. We cannot remove the current fear, but we can at least acknowledge this and be there for people. We do have a small supply of face masks. We keep hearing in the news about PPE and how desperate the NHS frontline staff are for getting the correct PPE. Of course, in their circumstances, what could be termed the viral load, the amount of virus that they're coming into contact with, they desperately need PPE. We need PPE for our ordinary work. We need our gloves and we need our aprons. We need to keep washing our hands, but we don't need face masks unless we are working with somebody who is actually symptomatic or known to have the virus. Should that occur, we will act very quickly to get out to our staff and families the PPE such as we have. Now, we've had some face masks delivered from Public Health England, and that's only about 300. It isn't many. We've got about another 300 behind them which we've had to purchase from Amazon. We don't really want to use them unless we start to get desperate. In Wales, we are told that we can get supplies of PPE if we need it, and of course we won't be taking any unless we actually need it. The way things are going at the moment, we haven't needed it. Hopefully that situation will remain if we all keep following the rules. We need to make sure that our clients are safe. The clients don't often have the opportunity to get out and break the rules themselves. It's only those people around them. A lot of our staff will have to go shopping for their families, and those are really difficult times. Please make sure if you are shopping, as I've said in previous bulletins, take a pair of latex gloves with you, use those while you're in the shop, take them off before you get in the car. When you get the shopping home, isolate as much of it as you can. It's only the fridge stuff you really need to touch. Try and keep that in one carrier bag. Remove what you need to the fridge and let everything else just stay where it is in the carrier bags. Just leave it for a good 24 hours if you can. And make sure you wash your hands as soon as you get into the house or as soon as you touch any of the purchases you've made. Remember, all sorts of people pick stuff up and put it down again. If you can make a mental note not to do that, don't pick up the wrong loaf of bread. Don't pick it up to see what the date is on it and then put it back. It's not good for anybody. So, we're all supposed to be staying in our homes. And I really ask staff, when you're not working with our service users, please make sure that you are staying in your home, unless you have to go to the shop. I know as well that staff have been absolutely fantastic and arranged to shop for our service users and our clients. And again, that does put staff at risk. And when you return into the service users home with the shopping, please follow the kind of rules that we're talking about here. Use the gloves. Make sure you wash your hands. Make sure you wash down what you can out of that shopping if you actually do need to take it out of that bag. So, the staff have been marvellous throughout this crisis, unbelievably so. We wrote to everyone following the NHS and carer clap last week, expressing our feelings about our team. We were almost moved to tears ourselves by some of the responses that we had from staff members. People were asking how we were getting through this and how we are as people, how are we feeling, and that was really nice. It was really good, and it did make us feel really, really good to have that kind of feedback from the staff. We can't say enough about how good people are being. We've had some very positive comments from families and from clients who feel very supported, and also we've had some welcome comments from professionals who purchase our services, and we've got to put that down to the whole team approach that we have in Bevris Support. It's everybody working together, keeping communicating, and make sure that we are doing our utmost to support our clients, and importantly, please, to support yourselves. Now, a tricky one. We're about to complete a letter for clients who have complex autistic presentations. This letter is designed to support those people to leave their homes in their vehicles with staff. The government has ordered that there be no non-essential travel, and has advised that travel allowed is to the shops for food, to the pharmacy, or to go for exercise. We desperately need to take some of our clients out in their vehicle, as they cannot understand the changes in routine, and this is causing them to react extremely badly to the situation. Getting some people out is essential travel, in my opinion. Even if we only get them out for an hour a day to have some essential exercise. And several of our clients cannot possibly exercise by walking directly from their own house. We even have clients who are practically hemmed in by roads. You could not walk down that road with a wheelchair. It's a country lane. We have to take them somewhere, and we have to do something with them. Otherwise, their routines collapse and their behaviour collapses too. Please bear in mind the need to maintain routines as well as possible. We will get these letters out to the relevant people. And if you are in one of those support packages and you're stopped by the police when you're out, then hopefully this letter will sort it out. If it doesn't, we're going to have to know about that as soon as possible, and we're going to have to try and take that up with the powers that be. On the whole, we feel we've got a plan, and we're going to keep this plan going as long as we have to. It's great, the managers, the management team, nobody's really asking what to do about this or about that now. It's not so new. Strange how quick it's become not so new. Initially it was, oh, this has happened, what do I do? Everybody was trying to absorb the guidance. The guidance does still keep changing, particularly if the lockdown gets heavier than it currently is. So everybody's settled into managing the situation so quickly, and I've got to say, we are so impressed. Situation looks like being here for some considerable time, but we'll all work our way through it. China is already getting its workforce back to work, and believe it or not, lots of the PPE we will all be using is actually made where the virus started, which is quite ironic, even though it is encouraging nonetheless. So please keep going as we are, and we'll all get through this together. So this is Chris, with ever increasingly long hair, signing off on behalf of Bev and Stuart. Thanks for your time.